Well, I am currently organizing a large study in Botswana to try to find the best way to use treatment as prevention.
As a Fogarty Research Fellow, I process samples for phenotyping from a clinical trial in Botswana to be used in phylogenetic analysis.
I'm leading a trial in Botswana to diagnose and treat infants as soon as we can in life, treating them with 3-drug antiretrovirals in order to try to get them off treatment later in life.
As research assistant, I helped to develop an HIV genotyping protocol. Using this protocol, it improves our data and also allows us to better understand HIV transmission networks and drug resistance in Botswana.
I support Phyllis Conkey and her work in Nigeria, and I've been doing that now for about 20 years.
So we're starting a new research study in Nigeria, and we're going to test a point-of-care test to measure the levels of virus in the blood for patients that are on treatment. And we think that will really improve their outcomes.
I help coordinate IRB submissions for HIV prevention and treatment clinical trials in Botswana.
I pay the bills, I pay the salaries, so researchers have the freedom to do the research.
I work directly with young doctors and nurses who focus on HIV medicine in Nigeria to teach them how to do research and evidence-based medicine.
I develop statistical methods for cluster randomized trials to evaluate HIV prevention strategies.
I'm a Fogarty Fellow doing research on HIV/AIDS transmission networks using samples from a clinical trial in Botswana.
I study immune responses to Zika virus in HIV-infected patients in Nigeria and Senegal.
My research is focused on the intersection between HIV and maternal child health.
I help to train laboratory technicians in our laboratories in Nigeria towards improving laboratory capacity and the care of people receiving HIV medication in Nigeria.
My work on HIV has taken place in both Morocco and Costa Rica, where I was working to bridge the gap between policymakers, patients, and physicians.
We really focus on infectious disease research, ranging all the way from fundamental biology through to field applications of this work.
I prepare data sets using clinical data from a large HIV program in Nigeria to measure patient outcomes and to understand the relationships with various risk factors.
As an infectious diseases physician, I do clinical research on children living with HIV and tuberculosis co-infection in Nigeria with the goal of optimizing treatment regimens.
I manage a number of federal grants that support PI/AIDS research.
I am part of a team that directs a large HIV combination prevention trial in 30 villages in Botswana.
One of the most important features of an epidemic is that it spreads along large networks. And our focus on research is to figure out which links to target in order to best block the spread of HIV and control the epidemic.
So outside of work, I work with a lot of youth. And one way that I feel that we can combat this disease is through education.
I work on improving the health of HIV-infected pregnant and postpartum women living with HIV in Botswana and the health and neurodevelopmental outcomes of their children, as well as mentoring my African colleagues on working on those issues.
I study viruses that circulate normally in the HIV epidemic, and the goal of my research is to identify hotspots of virus transmission and prevent new HIV transmissions.
I study HIV in pregnancy so that HIV-positive moms can have healthier babies.